Mr. Speaker. I spoke at a rally on the legislature stairs today about the service transition at the Royal Alex Regional Fertility Clinic, which won't be offering important uninsured services like IVF, and we haven't seen details on additional supports these patients will need. AHS said they'd look into it, but we haven't heard a thing. Patients have been told that they will not be reimbursed for services they already paid for and now won't receive. To the Minister of Health, what is the status of the support for patients who are affected by the changes at the Royal Alex Fertility Clinic?
Deputy Premier.
Thank you very much, Mr. Speaker, and to the member for the important question, and of course to all families who are struggling. And we all know somebody who is. About 1 in 6 Alberta families does experience infertility at some point. Our hearts definitely go out to them, and we're working to make sure that there's a smooth transition. Every single one of the patients at the current clinic has been contacted by letter and follow-up attempts by phone call to be able to talk about the transition plan, and any costs related to transferring biologic material are going to be carried by AHS to ensure as smooth a transition as possible. Mr. Speaker.
First supplemental.
Mr. Speaker, families who've been on wait lists at the clinic are now facing further delays. Some of these families have been trying to grow their families for years and are heartbroken at the prospect that they may not even be able to store their embryos, as these wait times come with additional costs for storage and transportation, creating further barriers. To the Minister, how are these people supposed to plan for their future family when they don't know when or even if they will be able to get treatment?
Honourable Minister.
Thanks, Mr. Speaker. And again, just to reiterate that the transportation costs from the current storage facility to the new facility will be borne by AHS, not by individual patients. I absolutely understand how nervous this is, and we do encourage all of the families who are impacted to please reach back out to AHS. They've sent letters and made phone call attempts so that they can arrange for as smooth a transition as possible, Mr. Speaker, because we know that additional stress is not conducive to good care. That's one of the reasons why the counselling services and other publicly insured services at that clinic will continue to be in place, Mr. Speaker.
Second supplemental.
Patients of the Royal Alex Clinic have been told by AHS to seek out services at the new private clinic on Jasper Avenue or the existing one in Calgary or perhaps in BC. Doctors trained in IVF at the University of Alberta may now have to look for work in the private sector instead of in the public system. Can the Minister of Health explain to us how she intends to strengthen reproductive health in the public system, or if she intends to continue to encourage privatization?
Honourable Minister.
Mr. Speaker, our track record is very clear on this side of the House. We stand for public health care and public access. Everything that is publicly insured will continue to be offered at the hospital and continue to be publicly insured. The pieces that were already privately delivered at that facility, at that hospital, the physicians are moving to a new clinic, and the physicians will continue to offer those privately insured services in the City of Edmonton. We are standing up to continue to reduce wait times, improve access for the publicly insured services, Mr. Speaker. And again, our hearts go out to any family that is struggling with fertility.